thank you very much, everybody. Thank you for inviting me. My name's Colin Wilson. I'm from Healthwatch Sutton. Healthwatch, I know there are some other people here from Healthwatch, but if you haven't come across us, then Healthwatch is an independent charity. There are, I think, over 100 Healthwatches around the country, but we have statutory powers with regard to the NHS and care providers. We gather feedback about local health and care services from patient service users. We identify needs and gaps in those services in particular. Always nice to have positive feedback, but mostly people come to us when things haven't gone well. And the idea is that we make the case for change. So hopefully, how things work is an example from a few years ago where we interviewed secondary school students about their mental well-being. We found that they had more support needs than had been understood, particularly, for example, affecting LGBT students. And we were able to make the case, or to be part of making the case, for extra funding for Sutton and the surrounding boroughs. So that's when it goes well. Of course, a lot of the time we all know that there is lots of unmet need out there, and however accurately you document it, there isn't necessarily funding available, but sometimes it works. Just over a year ago, we began to think about the issue of inflation and the cost of living. This was when, in the autumn of 2022, inflation had already started taking off, and that had become a major issue, which had precipitated, for example, many of the national strikes that we've seen in the last year. And in particular, there was the issue of the price of energy, which had obvious health implications in terms of people being able to heat their homes. And so we started to feel that the health implications of these things weren't being sufficiently talked about. We wanted to get them up the agenda. And we were aware that there was a large community event in Sutton called the Carshalton Eco Fair, with lots of environmental stalls and so on the August bank holiday a year ago. And so we decided that we would do a piece of research there. And this is very much, I mean, normally the research that we do, the surveys that we do, the one that I referred to there among the secondary school students involved, I think, 5,000 people. We've just completed a survey of primary school pupils about their mental well-being, which involved just over 1,000 children. But this was a much smaller affair. We went to the event. There we are at the stall on the day, and we spoke to 108 people. And this is the form that we had. And this was, as I've said, a very kind of informal thing. So sometimes some of us were asking people to fill in the form. Some of us were talking to people and then ticking the boxes as they watched. So that is not completely consistent. You know, this isn't a kind of rigorous piece of academic research in that sense. But we talked to people about what experiences they were having with the cost of living. We asked how it was affecting them now and how they thought it would affect them in the winter that was coming. I would say one thing that we found out after we had done this is that this was absolutely not a representative sample from the borough of Sutton. Sutton is in the southern suburbs. It's not especially deprived. There are some deprived bits, mostly in the form of social housing estates. But Carshalton isn't one of those. And the eco-fair, we didn't actually realise this because we all got there early, but the eco-fair actually has an entrance fee of, I think it's £8. So the results that we got are actually skewed in the direction of quite, well, people who can afford to pay £8, so that they would have excluded some of the more deprived people. Despite that, a majority of people said that they were having problems. Quite a lot of people talked about cutting back on heating, cutting back on food spending. And the thing that is, I think, most striking is that people were talking in particular about the impact on their mental health. Yeah, so I mean, you see there in graph form, it was cutting back on heating was the thing that people told us about the most. And when they thought about the future, when they thought about the winter, overwhelmingly, people were talking about cutting back on heating. A bit people were talking about cutting back on food spending. We heard people say the things that were reported in the press about they don't go to Waitrose now, they go to Sainsbury's and so on. But also, as I say, people talking about stress. And we did a word cloud of some of the comments that people made, and you can see that mental health comes up there quite a lot. People were worried about family members, people were concerned about family, and so on. And in particular, it was mental health that came out of the remarks that people made, that people maybe were worried for themselves, but most of this was quite a prosperous bunch of people, and they were more worried about others than they were worried about what was going to happen to them. We continued to pursue, to raise these issues. By now there were networks coming together. The council was convening a group around poverty, but we invited the chief exec of the Local Citizens Advice to come and speak to our AGM, and he did a presentation talking about the causes of the cost of living crisis in terms of universal credit not having been uprated, the fact that housing benefit doesn't cover all of private rents in many cases, the energy costs, which we were of course aware of, the inflation costs, and inflation is higher for people on low incomes because people on higher incomes can choose not to go on holiday or not to go out to a restaurant, but if you're on a lower income then essential costs are a larger part of what you're spending. Sutton, as I say, is quite prosperous, but the actual jobs in the borough are quite low paid. Lots of people are commuting into central London to work. There's the issue of childcare costs, and there's the impact of the pandemic. He stressed all of those, and stressed also the impacts of the crisis in terms of malnutrition and cold homes, health issues, especially mental health, and in particular issues around suicidality and suicide, that there is a fairly straightforward correlation between debt and suicide, which I guess makes absolute sense. You can see how that would come to be for people. So we produced two publications about this, which are available on our website. A quick briefing about the cost of living crisis, and the longer briefing about the health impacts from the work that had been done in Citizens Advice. And we continue to share information with other local organisations such as Citizens Advice Sutton, and you see their data that we've got fairly recently from them about how many people they're working with who have a debt issue, so that increased somewhat in the autumn, but actually it's now, there seems to be, I think what you see there is a cumulative effect of people struggling to keep on top of their finances, but despite the fact that inflation has fallen slightly, it's still at a historic high, and I think you see that reflected in the increasing number of cases that they're seeing. And I think this reflects something as well, which is that local community groups will have large amounts of data, which I think can be very useful for researchers. Often we are mandated to collect that by our funders. Sometimes that gets to the point of being a bit of a burden, particularly when different funders want you to record data in different ways, and I think that often groups will, that their main concern is service delivery rather than, recording these things and being involved in consultations and so on. But I still think that there is an enormous amount of useful data out there. So we have been raising these issues with the NHS. We continue to discuss them. For example, I was talking last week to a local vicar who's in a church on one of the social housing estates which are a focus of deprivation. She was saying that lots of the women on the estate work on 0-hours contracts, and that therefore if they take time off, if they're pregnant, they take time off to go to antenatal appointments, then they lose pay. So they're missing those appointments, and we know that that leads to an increase in the level of stillbirths. So that's an issue for us to address. We continue to work with the council. We would like to get more data. I don't think we've succeeded in doing this, from local libraries and places of worship. And we've also been talking to Sutton Food Bank, and we're part of a network called Together for Sutton, of voluntary organisations which are funded by the council. So these are the two documents that I mentioned, which you can download from our website. I hope you found that interesting and useful. I'll take questions.
So, one example of that, a couple of years ago, and again, a lot of the stuff I'm talking about is often kind of before my involvement with the organisation, but I've been kind of learning quite quickly about it. But a couple of years ago, we did a report on the JSNA system, which I'm sure all of you already know, Joint Strategic Needs Assessments, and how that system is operating in London for queer people. And again, I think that was kind of coming out of feedback we were getting from our members about how some councils were kind of failing queer people. And indeed, kind of when we did a kind of survey of all the joint strategic, the JSNAs of all the different boroughs, and obviously they're supposed to factor in people with protected characteristics, and we were finding that lots of those JSNAs had only kind of very minimal material on queer people and their needs, sometimes none at all. There were one or two councils that were kind of examples of good practice. Richmond, I remember, for instance, was a good one, and was kind of like involving kind of local queer groups, communities in its strategic policy making. But yeah, that report was really kind of talking about how, as a whole, the JSNA system in London was kind of failing queer people. And that's an example, I think, of kind of work that we're doing kind of coming from bottom up rather than top down. We also try as much as possible to kind of involve co-researchers from the community in our research. And the research that we're helping with in Dundee is an example of that, kind of training up local members of the community, local queer members of the community to gather data on our behalf, do interviews, record data. And what else can I tell you about? Well, the project which I was brought in specifically, I work 3 days a week at the charity, and my post is funded by Trust for London. And it's really supposed to be specifically working on one big mega project that we're doing, which is called Precarious Lives. And that project is looking at the experience of financial and material precarity among older queer people in London. And again, I think our focus on this is really kind of responding to kind of comments, feedback we're getting from our members, particularly obviously in light of the cost of living crisis, which we've already talked about. And this is a big project for us, with a bigger kind of scope, more funding than we usually have. I think the housing report that we did a few years ago was the kind of closest kind of comparison. But this is a big project for us. And I guess we have a kind of working hypothesis about the kind of causes of financial and material precarity. And by the way, I'm tending to use that rather long-winded phrase. I need to kind of like work out how we're going to kind of communicate and talk about this project. But poverty can be an extremely stigmatizing word. I've tended to avoid using it. I mean, in this context, you know, we can say this is a project that's principally about poverty, the causes of it. But I must admit, I have tended to avoid that word, especially when we're trying to kind of get people to kind of engage in the research with us. Obviously, there are kind of, you know, national factors with the picture of kind of like why people might fall into poverty, about cost of living crisis, about the kind of downgrading of the benefit system. Then we have kind of London-specific factors, obviously kind of the proportionately higher cost of living in London. Also, the kind of housing stock is really important, the fact that so many Londoners are renting. Renting is another big risk factor for poverty. The high proportion of BAME people in London is also kind of part of the reason why a high proportion of Londoners are in poverty, because there's all this kind of reasons of structural discrimination, which means that being non-white is a kind of higher risk factor for poverty. And then, of course, you've got age and kind of lower incomes for older people, higher costs which are associated with age-related poor health or disability. And then kind of like in this kind of intersectional picture, you've got, you know, kind of how kind of queer lives fit into all of this as well. And I mean, obviously for one thing, queer people often gravitate to big cities because there's more chance to find a community there, but then in these big cities they have higher costs, and that obviously is particularly true in London. And then you have this whole topic of minority stress, which I'm sure is a concept that many of you are familiar with, but for anyone who hasn't encountered it, it's the idea that kind of living with minority status long-term has this kind of long-term impact on your sort of mental, physical well-being. Sorry if that's a rather clumsy summary, but as I say, I'm relatively new to this sector. And then obviously, those long-term impacts on your kind of physical and mental well-being then have this long-term impact on your ability to earn, your ability to save. If you layer into that what it's like for trans people, with the kind of like, you know, greater level of stigmatization and prejudice that they face, and particularly, you know, in our current climate, which we're seeing this appalling stigmatization of trans people within the kind of political realm, which is kind of having this kind of awful knock-on effect on public opinion, public attitudes towards trans people. So obviously, kind of like factors are different, you know, kind of for different kind of subgroups under that kind of LGBTQ plus umbrella. Then you have something like HIV, the long-term impact of people living with HIV. You know, the stigma around HIV has gone down quite a lot in recent years. On the other hand, you know, older people may have been living with HIV for a very long time and have lived through kind of periods of huge kind of stigma around HIV, and then the impact that that has on their mental health, on their kind of like long-term ability to earn, to save. I fear I might maybe going over time here, but again, this is another project in which we will involve co-researchers. We're at a relatively early stage. I've done the literature review, I've put together the survey that we're going to use. We're just starting to distribute that. And if anyone has kind of good tips on networks through which I can distribute that, then please do come and let me know. Again, for this project, we will be using co-researchers from our community to help, for instance, with the interviews and focus groups that we'll be doing. Focus groups are going to be an important part of it. We know from our previous experience doing the housing report that we won't necessarily get enough data that we want from particular parts of our community. When we did the housing report, we did focus groups with lesbians, with the ME people, with trans people, with bisexual and pan people, all groups that we felt that we weren't getting as much data from our survey as we wanted. And as I say, kind of co-researchers, train up co-researchers to help with those interviews and focus groups. So I think that more or less kind of concludes what I was going to tell you about. But obviously this is a London-specific project. If any of you have particular questions about it, or if you're interested in how you might kind of work together with Opening Doors at some point in the future, please do come and introduce yourselves to me. So, thank you.
Just to start by saying that while I'm the involvement coordinator at Applied Research Collaboration, ARC South London, I'll be talking a little bit about my own views and experience. I am or have been a carer or support giver to people with most of the conditions covered by the ARC, as well as having the occasional long-term condition myself. I've been a carer for about 35 years. I've been active in various communities, including looking at ways in which research might be of use to those communities in getting our needs met. And at the moment, I work in Camberwell, which is about 3 miles away from here, and I work about a mile away from where I used to work 30 years ago. So I was previously in a railway arch almost underneath Peckham Rise Station, where I was working for the Black, Lesbian and Gay Centre as an outreach and development worker. So I've had a chance perhaps to compare those parts of London, that Peckham and Camberwell area, 30 years ago and now. And in many ways things have changed, but in some ways there are similarities. And the fact that health and social care inequalities persist is one of those. Now, in many ways, those areas or parts of those areas have been smartened up, and there's a similar story, I think, in other parts of London and in many towns and cities across the UK. But there are also very obviously pockets of deprivation and sections of communities who experience very high levels of ill health and inadequate care, and some of that is also linked to the factors that affect health, such as poverty, poor housing, and so forth. And in some ways, it's more challenging if you're struggling in one way or another, and you're living next door to people who are or appear to be very prosperous, though again, appearances aren't everything, as has been pointed out. Which raises that question, how can we tell how much these areas have changed, or any other areas, over time, and why? For instance, in terms of health inequalities, which have been described as avoidable, unfair, and systematic differences in health between different groups of people, is any improvement or worsening just due to gentrification, with maybe better off and healthier people on average moving in, and less healthy, worse off people, communities experiencing greater disadvantage and discrimination, moving out? Or to what extent is it due to improvements in particularly health and social care and initiatives in particularly at reducing health inequalities, or changes in society that affect people's health or access to care? What sources of data and knowledge might assist in answering such questions, which might give a pointer as to what helps or hinders positive change locally and beyond? So, we do have a roving mic. So, any suggestions about how we can tell, besides just looking around, listening out to people? What are the sources of information that might give us a picture of what's been happening and why? Okay, so Ken.
Yeah, feedback.
Sorry, I've got to.
No, it's
So
all right.
I've got the mic. Yeah, can we start over there and then we bring it over to
In regards to your question regarding how can you find out about local health and care inequalities and what can help and what. Sorry, everybody. I think those information can be gained from getting into local spaces where the general public frequent. There's a heavy traffic of people, and speaking to them just as you'd speak to a friend, and just ask them, what do you feel is really affecting you, what's really impacting you in these areas? And that's the way I think, without, all the pomp and ceremony and all the bureaucracy, just ask them, they'll tell you. They will. They would express that to you as to what's going on, and you can gain a very clear picture of what is impacting them, and you'll be able to gain the information that you need to go forward and to do any improvements or any work or any projects that you may need to implement.
I agree 100% what the lady said. I was just going to say feedback, when you're getting feedback like you've asked today about what we want, what we feel we gained from this meeting and what we haven't gained. That to me is the difference. It's not about what we feel is positive, but what is negative, so that can be improved on. And the other thing, including voluntary agencies. Because sometimes, I don't think sometimes when it comes to certain organisations, they don't involve a lot of voluntary agencies. And we know the community go to voluntary agencies to get services, and I'm sure they do feedback as well. So that's where I would say start looking at, get voluntary agencies more involved to listen to what their issues are. Not as an organisation, but the people who are going to that organisation, what they are saying about the inequalities regarding health. And sometimes it could be the inequalities in colour of your skin, your faith, your religion. That's inequality sometimes, where people are judging you by the colour of your skin, not the illness you've got.
Okay. Any other sources of information and knowledge? I think we have Vita and then Sarah.
Thank you. My name is Vita. I'm a service user and a peer researcher, and I work with the ARC. I'm on the public research panel and on the maternity and perinatal mental health team. I've been thinking throughout all the presentations, two things. One thing is how close healthcare provision, healthcare research is to politics, and how much closer it should be in order for it to be proved. Because for any kind of real improvement, it's then the politicians that need to sign off the checks. And both to carry on research and to bring in improvements in a real way. And the other thing that I've been thinking throughout all three presentations is how different people, and for example, at different ages have different standards. So how can we tell how much things have changed? It is very hard to do that by asking people, because people in the same community but belonging to different age groups have a very different way of expressing their situation and their circumstances, because ways of expressing circumstances have changed throughout time. So people who are 30 years older might look at their, for example, economical situation and describe it differently from people who are 30 years younger, even if they're in a completely same situation. So I do believe that as well as going into the community, which I have been doing as part of the ARC projects that I've been involved in, and I really do believe in this individualized and personalized approach. But in terms of connecting improvements with the political sides of it, we need to have some kind of standardized approach that comes from data that is more, I don't know, numerical and statistical.
Okay, and Sarah, briefly, then.
Thanks. Yeah, my name's Sarah. I'm from Healthwatch London. And I feel like I'm being asked a public health exam question here. So people have eloquently described the importance of people's lived experience, but you were hinting at that there's much more to it than that. And I think you've asked two questions: what's happened to health and care inequalities, and why, and is it just due to gentrification? And I mean, there are lots of different sources of information. I suppose that's part of the challenge, really. The sources of information, data, quantitative information, are quite broad and big. If you wanted an overview, you'd go back to the Joint Strategic Needs Assessment of your local authority and hope that the public health team would pull together the information for you. But I'm just thinking that if you wanted to look at the impact of gentrification, you'd probably go and look at sort of the change in housing, wouldn't you? The change in social housing, the change in private rented accommodation, the change in the proportion of people who bought their own house versus the people who are now having to rent, the proportion of young people who are still living at home against what was happening before. That would be a sort of thing. You were specifically looking at something to do with housing. You want to delve into housing data, it seems to me. Depends what you're going to be looking at. But I'm sure there's so much complicating and overlapping factors in terms of what you're trying to ask.
Yes, I tried jotting down some of what I could think of. And as others have pointed out, the picture is complex. So there are sources of statistical information and other more word-of-mouth type sources, plus research data. There's the census information, National Health Service, public health, social care statistics, and statistics on factors affecting well-being. There's research on what's happening in South London by researchers in universities, the NHS, local authorities, community and voluntary organisations, and we've heard a bit about some of that. And other research, sometimes in other parts of the country, like by, for instance, other ARCs similar to this one, but also a very wide range of other researchers who might be struggling with some of the same questions in Manchester or Birmingham or other parts of the UK, or indeed other parts of the world, in trying to make sense of health inequalities, what's happening around them, the gaps in care, and what to do about it that works or doesn't work. There are reports that are not based on research, but nevertheless throw very important light on what's happening by patients, disabled people's carers and community groups and other organisations. And as was pointed out, observation, listening, experience are very important too. But again, from some of what's been said. Often those facing greatest inequalities are least likely to be counted or have their details fully and accurately recorded, or perhaps talk about all the factors affecting their lives, or be able to communicate easily with others for various reasons. Lack of safety, access and resources can get in the way of exploring diverse experiences, as well as weaknesses in research culture and structures. Some people are struggling just to survive, to keep their heads above water, so being involved in research or becoming researchers, even if those the doorways are open, is difficult for them. The contexts keep changing, so what might have worked 10 years ago, 20 years ago, may not necessarily work in the same way now. For instance, taking into account factors like the cost of living crisis, the impact of the pandemic, various structural changes in health and social care, other things that are going on around us, the strain that services are under. And making sense of connections and exploring possible solutions can be complicated, let alone acting on what has been found. So I believe that no one set of people, no one set of organisations can do it on our own. Bringing together knowledge from varied sources and perspectives, especially from people with relevant lived experience, even though this may be gathered in different ways, filling gaps and sharing insights and challenges can be helpful in drawing on research to address health and care inequalities at local and wider level. And this is something where working together, drawing on knowledge of different kinds, recognising that that it is almost always going to be imperfect. There will be gaps, but if we can be aware of that, we may be able to fill those gaps more easily. If we can communicate with one another and explore things from different angles, recognising that risk that some people will fall through the cracks, that their perspectives and needs will be heard, and that will often be the people with highest levels of need and experiencing preventable inequalities. Together, this is something that I believe we can address and tackle. Thanks.